Olu's here. So I just want to take this time to thank you for being in the course, and I'm going to share just an overview of what we're going to do tonight. So we'll go through a syllabus review. This course has been open to you for about a week, but I know with everything going on, oftentimes people come on the first week and they haven't really been through the syllabus. But if you have, you'll probably have some questions, and so we can address those. I can point out a few things in not just the syllabus, but also in the course, in the Blackboard course, where to find things to save you frustration, hopefully. There's an assignment in here called the DNP Essentials Competency Self-Assessment. I'm going to talk about that. I'm going to talk generally about your DNP projects of interest, because when you get to the practicum part of this course, it goes in one of two directions. I want to make sure I don't have somebody waiting. Hold
on. Dr. Lord, please, can you record for Camelia, please?
Yeah, I am. Okay. Yeah, it's being recorded. Yeah.
Thank you.
People use the practicum in one of two ways. The most common way is that people use this practicum to expand their understanding of the area of interest of their DNP project, even if they haven't been through the DNP project courses yet and have their proposal. This actually works best if you haven't formulated in the form of a proposal your project, because this gives you a chance to expand your knowledge in that whole area of interest. Sometimes people pick an area that they're very familiar with. Oftentimes they pick an area that they're interested in, but they don't have a lot of deep knowledge. And so that's what most people do. The other way is to look at the self-assessment of your own perception of your competency around this document that some of you, if you're in education, you're going to be really familiar with. If you're not, you may have never seen before. Produced by the American Association of Colleges of Nurses, and it's called The Essentials. There are a lot of competencies in there, but there are 10 essentials, and they are at the pre-licensure level for undergrad and then for advanced education. So you're going to do the assessment with a tool that I've prepared. You'll just go in and do it, and you'll get a lot more information about this. But you will identify areas where you feel not as strongly competent as others. And so once you've done that, you could use your 120 hours of practicum in this course to focus on things that you might do to improve in that area, to get more understanding, to find a preceptor maybe that really can help with that, and so forth. It is those of you who are NPs, this practicum, if this is your first administrative type practicum, it's going to look and feel very different than your NP course practica, where you have very clear goals. We hand you your goals and objectives for it. You may have to develop some individual things you want to work on, but it's very structured. You record every case you see. You're recording into the recording software project concert every day, and so on and so forth. That's not the way this runs, but I will explain it to you. This runs much like the practica in the nursing administration program or in other DNP courses. It is what's called indirect. And I'll explain to you what that means and how we count the 120 hours, because it's not as burdensome as it might seem. And it isn't 120 face-to-face hours you somewhere with a preceptor. It's not that. You will do some of that, but you don't have to do 120 hours of it because it's indirect. I'll talk about that. And we're also going to talk about making sure your clinical clearance, that is your ACE map things, is up to date, because that has to be up to date. We'll talk about the setting. You can throw out ideas. I don't have any prescribed ideas about settings, We've had people do practica in health departments, in area agency on aging offices. Somebody did one right at Madonna with who had an interest in mental health promotional activity targeting college age kids. And he did it with somebody in student services at Madonna. So it's a wide range of things. Other people, are working in the clinical area that they already are familiar with, and they find somebody to do some additional work. But it's usually not seeing patients. We don't really anticipate you doing patient visits in this thing. You're really taking a higher level look at how do systems work? How could I use the knowledge I gain here to formulate and clarify and refine my DNP project topic. My experience in my DNP, which was not all that long ago, I started my DNP in 2014. I was at Wayne State University. And I knew that I wanted to look at why, despite the fact that we had very usable evidence-based guidelines for obesity available for more than a decade, that they were rarely used, rarely implemented. The more common of things that in this, I hadn't just made up. I mean, there's a lot of evidence to support this. Providers deal with all the consequences of obesity, but they very often don't directly address obesity. So they deal with heart disease, all kinds of cardiovascular illness, the 13 cancers that are associated with the obesity state, hypertension, and of course, type 2 diabetes and all that, hyperlipidemia, all the junk. They'll treat that, but they never treat the obesity. They don't put it on the problem list and they don't treat it. And they certainly don't follow the guideline. So that was what I was interested in. So the thing was, I came into my DNP project after spending 30 years in hospital administration. So I needed to get really, that was my impression. I won't take time tonight to explain why I even had a thought, but I did. I was an executive sponsor for a bariatric surgery program in the organization where I worked. And I heard the stories that the people who were arriving for bariatric surgery were talking about, and that's what triggered me. So anyway, what I did in a similar practicum over at Wayne State was I connected to Mercy Primary Care, a primary care office on the east side of Detroit, and just went in there and watched what they were doing and talked to the providers about the challenges they had with obesity and just kind of refine my understanding of it and what it was really like, and all kinds of different things. So it can be pretty general, or other people do things really specific. I'm only telling you this so you understand you have a very broad range of things you might want to do in this 120 hours of practicum hour. You will need a preceptor. You can have more than one, but you need at least one. I will do a site visit, but we almost always do them by Zoom anymore because it's easier for the preceptors. And you can just Zoom at the same time as your preceptor. We can all be, I don't have to be in the same room with them when I do the site visit. That's very unlike what I do when I'm clinical faculty in NP courses. I show up, we do a real site visit, I want you to do a visit, that kind of thing. Not in this course, different. What I want to know is that what you're putting in your journal entries and the information I'm getting through Project Concert, because rather than doing it by case, you'll do like I was there 8 hours. These are the things I did. There's the check sheets you're used to seeing. How does that relate to, oddly enough, the essentials? All that kind of stuff. I'm there to validate that that isn't just a lot of hooey and you didn't just make it up and start typing stuff in. Not that I think any of you would, but you get what I'm saying. It's an accreditation requirement for us to validate the stuff and the things that we get from you when you describe your practicum. So that's the reason we do the site. Here comes Carrie. And that goes pretty much like the other practicum you've been in. Is anybody tonight never been in a practicum course? Let me stop my share so I can see all of you. You can just raise your hand. Never been a practicum course at Madonna University ever. You don't have any idea what I'm talking about. Oh, okay, good. Well, that makes it much easier. Okay. So let me
I
talk
have a
first
question
about,
though.
yeah, absolutely. You have to tell me who you are because I can't
So
see.
how do we get it? Okay, hold on one second.
Who's speaking to me?
Oh, this is Olu.
Oh, hi, Ola.
Yeah. So how do we pick our preceptors? Because our other practicum courses, we get our preceptors from the school. So how do we get a preceptor here?
Depends on what you want to do. I will help you if you can't find something. What do you want to do? What are you interested in?
In my DMP project?
Yeah.
So I'm thinking on doing something on AI, artificial
And what?
intelligence,
And what?
on artificial intelligence.
AI. Okay.
Mm-hmm.
And using it in a clinical setting or using it for teaching or what?
Clinical setting.
Okay.
So I'm saying, I mean, I can refine it. It's subject to redefinition and all that. But what
Right.
I'm thinking is nothing or MP readiness, like our involvement with artificial intelligence in our practice.
Sure. How much experience have you got using that in your practice so far?
I was
AI.
recently speaking to some. I think the only one that I'm aware of is the sepsis triggers. You know that is an epic.
Right.
Yes, that one. And then I heard that U of M, they have AI doing something on their X-rays. I don't know if it happens where I work yet,
Right.
but I don't.
Right.
I'm gonna look into that. So I was just told, so I'm gonna look into that if they're doing the same in the facility where I work. But I don't know.
Right. I think what we could do to help you connect to somebody who's really active in AI. So now you could go in a couple of directions. You can go right at AI in a clinical practice setting and observe and work with people who are using it. You're not there as a clinical provider nurse student. You're there observing it and learning about it and how it works. You could maybe try a couple different places, find out what they're doing at Cornwall, what they're doing at the U of M, and I can help you find access to these places. But the person who knows that the best on Madonna is Dr. Reynolds. So I would get a hold of Dr. Reynolds and tell her what you want to do, because you might also, even if you're not thinking about it in terms of education, because there's a lot of AI now coming into education world. But she's doing some work on visual reality and AI, and you might be able to do your practicum right there with her.
So I spoke with her already though. So they're already doing it this semester. So it's gonna be too late for my project.
It's gonna what?
It's gonna be
What
too
about your?
late for my
When's your project? Where are you in the curriculum?
So my project is gonna be next year. Like the DMP project is gonna be next year.
Yeah.
Winter
So what do you mean
and
it's too
summer.
late for your project? I don't get that.
So
You're going to learn more about it so you can better design your project.
okay.
That's
Okay.
all.
You're saying I can work with her this semester. Okay.
Yeah, now. Yeah, now. Right now.
Okay.
Yeah.
Got
I
you.
mean, you might
Okay.
go back and do something on your project there with
Yeah.
her,
Mm-hmm.
and it might not be with her, but she might know others that she could
Mm-hmm.
help you connect to so that you could go
Okay.
observe and understand it. And at the same time, because this is indirect practicum, you're going to probably want to do a whole lot more lit review than you've done so far about AI. I'm just guessing. It'll help you in your project. You can use this time now to do your lit reviews. That's not cheating. It's okay to do that. So you can really, it's an indirect practicum. It's an administrative type practicum, and you have a lot of latitude. We just want you to spend your time doing it. One of the reasons we put this in the whole curriculum, other than to meet those objectives, is if you have got to have 1,000 hours of, and I'm supervising this practice. In case you wonder who's the supervisor, you have a preceptor, and I'm supervising your practice. You have to have 1,000 hours of supervised practicum after you got your BSN in order to get a DNP. That's an AACN standard. So some of you, if you're dual track, you go way past 1,000 hours. You don't need any extra hours. You still have to do this course because it's in the curriculum. But some people come up a little tight, depending on what you walked in with. How many certifications did you have? What, all the other ways. You went through that when you came into the programs. One of us sat down with you and calculated how many more hours you needed to get to 1,000. One of the reasons this course is here is to help people get to 1,000. It's just practical. But I think you can find something. We can find a lot of things for you to do around AI that'll get you through this practicum.
Hey, Dr.
Sorry about that. Thought I had that turned off. Yeah.
There is a comment that says yes, no idea when you were asking about the practicum from IQEAL. So I wasn't sure if they got.
I'm sorry?
I said there's a comment in the box that says yes, no idea when you're asking if everybody's.
Oh, Iqbal. Yeah.
I wasn't sure if they got it.
Thanks, Mindy. Iqbal, what are you thinking? What are you thinking about you might want to do with your project? What do you want your project to be?
I haven't even think about it, Dr. Lauterbach, but I'm pretty sure I will go something into like women's health, might be like mental health, postpartum or something like that.
All right.
Yeah. So what exactly I have to do? Like I have to look for a preceptor, or I really don't know where to start or how it's going to be.
Well, if you look, we've got a clinical conference coming up. We only have 3 in the whole semester, and the next one comes in 3 weeks on purpose. Because when you leave tonight, I'm going to send you off hopefully with some ideas percolating in your head.
Okay.
And then you'll be back in 3 weeks and we'll firm those up to get you connected to somebody. That's kind of how it works. The other thing, if you don't want to do it around an area of interest related to your DMP project, in the next 3 weeks, you're going to complete as an assignment in the course this self-assessment of your own perception of your competencies related to the essentials. You're going to know a lot more about it because you're going to read the essentials and you're going to look at the tool. It may sound like gibberish now, but it won't in a minute. It's very pragmatic and easy. You just check boxes. Likert scale, like low, medium, middle, high, very high kind of thing. And if you really don't have any idea what you want to do for your DMP project, or you're not ready to go try to learn more in the real setting, just fill a gap. We'll look at where you should work to fill the gap you've identified in the competencies. A few people have actually done it, but actually most don't. Some people want to know more about finances, even though they've suffered through 7810 and all that, they still want to know more about finances. Okay, I can help you with that. Or they want to know more about leadership. They want more leadership than we have built into the program. I can help you with that. I can get you connected to leaders. I can, I will help with that. You don't have to go out in the wilderness on your own. However, I would say this to you. You are now doctoral students. And one of the things you learn is getting comfortable picking up the phone and saying to a stranger, hello, my name is Bud Lauterbach. I'm a DMP student at Madonna. I'm interested in this, and I understand, you do this kind of work. Would you be willing to talk to me about a practicum? And being willing to hear no a few times. That's just part of being a professional at this level. You have to be able to do that. So I'm not going to just hand it to you like we probably do. The AACN says we have to make sure you all get preceptors. And the reason is, bluntly, if you don't know why, in our NP education programs across the United States, there are traditional ones like ours, and there are all onlines that run on a very profit motive kind of business model. And they took a lot of people's money and didn't help in tuition fees and didn't help them at all find preceptors. It was going to be a real problem. So now we have a regulation that says you have to do it. You have to find a preceptor. We will find you a preceptor. I'm not worried about any of you not finding a preceptor. We'll get you the preceptor and we'll make sure you get your hours done. But remember, it isn't going to be 120 face-to-face anyway by design. We have a lot of flexibility. It'll be okay. I face this every time I run this course. I know the first night people are freaking out. It isn't a freak out. It's okay. It'll work out. It really does. I've now taught this course, I think, for 5 years and probably 2 out of the 3 semesters every year. I mean, I've run this course a lot and it works.
It works.
Yeah. Part of it you're going to have to take on faith. But Iqbal, I will make sure that you end up where you need to be.
Thank you so very much, Dr. Beck.
You bet.
That's great.
All
Thank
right.
you, Mindy. Thank you very much.
Yeah, Lauren.
Dr. Lauterbach, just 2 things. I wrote in the chat, so I'll just read it out.
Oh, yeah.
Does a clinical have to be completed in the US? Because Okay.
Yeah, that's an excellent question. So Madonna University has a license for where we do teaching, basically. And it does not include Canada.
Okay.
Not a problem. And here's why. This is an administrative practicum. I've had students in the admin program who relocated to Texas, and they were able to finish to Texas, because we can go online internationally. It's just what's on grounding. But you're fine. You can do stuff in Canada, no problem. Yeah.
Okay, because I'm thinking
there's actually a list of countries and states that are excluded, and Canada is not in that list. It's a small list. It's like Qatar and you know, all sorts of places that just for their own purposes of wanting to protect their educational organizations, do not participate in this association of countries. They don't want any other educational institutions in their country.
Okay.
We aren't going to be in any of those countries.
Yeah, I know.
I don't have it memorized, but I've read the list. We aren't going to be.
Yeah. Okay, perfect. As long as I could maybe go with a CNO of the local hospital, and then
yeah, definitely.
It would be helpful for me. And then my second question was, you had said something about ACE-MAP and Project Concert. I just wanted to clarify. So while we're doing this practicum, we are logging a journal in Project Concert every shift that we do with the okay.
I'll show it to you tonight.
Gotcha. Okay. And then
it looks a little different than the ones you've done for your NP practicum, but I'll just show you what it looks like. You'll just, once you open it up, you go, oh yeah, I get what I do. Okay. It's very simple. It's simpler actually than what you have to do for the NP.
Sure. And then ACE-MAP is, I mean, my understanding.
Is an agreement that all of the hospitals in Michigan formed under the Michigan Hospital Association aegis, so that it's a clearinghouse of clinical clearance data to let students in. And the thing that drives this, other than they don't want to let anybody in who's a vector of disease anyway, is Joint Commission is very, very careful and picky about this. So, and over my 35 years of administration, I mean, it was loosey-goosey originally, you know, whatever the school said you were okay, you're okay. And now they want to know that everybody who comes in there, whether they're physician residents, whether they're medical students, nursing students, nurse practitioners, I'm practicing, everybody, you know, radiographic students, everybody, you have to meet the standard of an employee. In other words, you know what I'm saying? All the titers, all the pulmonary tuberculosis screening, all that. That's where it comes from. So they built ACE-MAP as their software. And the person at Madonna who runs ACE-MAP is now called Kristen Kalmbach. Kristen Kalmbach is our data coordinator. Here's the deal. If you don't land in a Michigan hospital, you really don't have to worry about ACE-MAP. It's Michigan hospitals that need it. So if you're over in Canada, they don't use ACE-MAP. They may require you to provide them, you know, you can just download that out of ACE-MAP. You can just print off your ACE-MAP and now it's all duplicated in Project Concert. But that's what ACE-MAP's about. But I just want you to know that Kristen still has to notify the hospital. If you're in a hospital, she has to notify them you're coming. And by the way, if you're going to the U of M, this may not work at the U of M, because they are rigid about they want nobody in there without at least 4 months notice.
Right.
Doesn't work for admin. Works okay for the NPs if they know they're going. We found a few workarounds though, so we could try. You know, I'm thinking of what I was just telling Olu. You know, we'll think about how we could make that work.
Okay. All right. And then I had one more question, but I might be jumping the gun. It was about the discussion boards, but I can wait if I'm going to.
No, bring it up now. I'll write it down if I want to wait to answer.
Okay. Just working, just looking through the discussion board postings, it says in the syllabus that we have the discussion boards. There's 5 of them on weeks 1, 5, 6, 8, and 10. But in the course content, when you go to discussion boards, it looks like there are 7 postings and it's different weeks. They don't coordinate. So is that
right?
Okay.
No, I fixed it about 2 hours ago.
Oh, okay. So maybe it's just not up in our, okay.
Yeah, here's what happens. This course runs in 16-week semesters and in this 14-week semester.
Gotcha.
So I have to do this kind of accordion squeeze on the course every year. And then if I'm not careful, when I because we don't start from scratch every semester with the same course. We course copy from previous semesters and update it. And I screwed it up, basically. I went, oh God, you know. So we do have seven weeks of discussion board. They still account for 300 points total. Right. And so that gives us this weird number of 42.8 or 45.2 points anyway. Still 30% of the grade. But yeah, it's fixed now. When you go back in, you'll see that I actually did that when I got home from work a little while ago. I went, I was kind of scrolling through.
So it's fixed now in the sense that we have 7 discussion boards,
correct.
Not 5. Okay.
Not 5.
Okay.
7.
So
right.
do this. So there are 7 of them. Okay.
Right.
Yep. 7 discussion board postings. Okay. So on Blackboard is correct. The syllabus is incorrect, or it had been.
They match. Now
they do because you fixed it. Okay. 7 postings.
Correct. All right. Let's have a look at the syllabus. Oh, wait, Mindy, do you have a question?
Yeah, just a quick one about ACE-MAP. I've got everything cooking in there except for the liability insurance. And I think Madonna provides this, correct? So do we have like a little policy that we upload, or do we not worry about it?
Why don't we ask the people on the call, because they've already done it. And I've never actually observed how it happens, but I think you get it from like student accounts or something. Don't you pay $50 and get it? Do you guys, can you explain to Mindy how that works?
Yeah, you have to go back through the Madonna website and pay, I think it's about $35 or $40. Then they'll issue you a new certificate to upload there.
Okay, so the Madonna website, just look for liability insurance?
Yes, if you text me your email, I can send the link to you later on.
Rockin'. I'll put it right in the chat to you, love. Thanks, Roland.
You're welcome.
Thank you, Roland. All right, let's move on to the syllabus. I'm not going to belabor you looking at every point in the syllabus. I'm not going to read the whole thing to you. But here are the dates that we will be online in this, what I call clinical conferences, because I'm not lecturing. There are really clinical conferences. It's a web-based course otherwise. In addition to these course objectives, you will write practicum objectives once you have a better idea what you're going to do. And then at the end, you'll write up about how you met or didn't meet those objectives and why. Got the courses, the textbooks, and the didactic component of the course. We always spend more time talking about the practicum, but the didactic component of the course is not connected to the practicum. It's fine if they overlap, but generally not connected. The first half, we talk about social determinants of health. And you have a book called Caring for the Vulnerable that's been around for a long time. You have an updated version, but it's a standard. It's really good, I think. And then in the second half of roughly half of the semester, we'll be talking about data-driven quality improvement and interprofessional approach. So here's 2 things. Why would we put these together? This course, we really, I built it. I was assigned to do the course way back when. And the person who was then actually the predecessor to Dr. Chan, her name was Dr. Gail Liss. She needed a few things, filling gaps that we didn't think we had enough of in our curriculum. One of them, of course, was the hours. I've already explained that to you. We didn't have enough content on social determinants of health, and we needed something more about what we then called interdisciplinary, but now called interprofessional matters. And so I knew right away what I wanted to do because I was fresh out of my DMP program then. And I had a great whole course in social determinants of health using this textbook. So I said, well, I know what I want to do with that. But then I got thinking about, well, what do we want to do with interprofessionalism? So I looked around, and they kind of fall into 3 buckets. If you do a lit review or a search and just said everything about interprofessionalism, it's about education, interprofessional education. It's about interprofessional quality improvement, or it's just this vague kind of general understanding each other's roles, and it's kind of the civil behavior of interprofessionals. I didn't want to do that. I think we all know a lot about that. I didn't think I could build much content that wouldn't be what everybody's lived in their own work experience. But we do get a little bit of that in here. I do have some things in the course that may expand on that. But what I said to Dr. Lisson, she agreed to, was I said, I would rather have an outcome of interprofessionalism. Why is it important other than everybody feels good? Let's, how are we making patient outcomes better through interprofessionalism? And that comes through interprofessional quality improvement and through practice, just the normal open dialogue, listening to each other, paying attention to what people from other professions are saying, and not just disregarding them because they're not in your little silo. There is that part, but this is focused on how do you form teams? How do you work through problems to achieve quality improvement in an interprofessional environment? And this book is written by somebody I actually know. I worked with her at Trinity Health. She's also a former dean from Grand Valley. And I don't know what Tricia Thomas is doing right this minute, but she's just really, one of those people you immediately see is very credible when you meet her. She's a very credible person. Anyway, so that's what we're doing. So that's kind of how we put this course together. All right. All of this is boilerplate. You see it every time. Here are the assignments. You have a determinants of health literature review. And that comes up pretty soon, comes up in June. If you're going to do something in your area of interest, rather than filling a gap you've identified in your competencies based on the essentials, I really encourage people to think about, look at their area of interest through the lens of social determinants of health. So somebody said, a lot of people say, well, what I'm interested in, the social determinants of health just have no impact on it at all. One person was working in an intraoperative area and wanted to do their DMP project was about handoffs in the intraoperative area and then the outcomes from teaching and at the immediate time that learn, like PACU and stuff. And they were absolutely convinced that social determinants of health had no impact there at all. It wouldn't help at all. And they ended up learning a lot about how it really did matter and how the problems we have is many of our protocols just built, they aren't necessarily evidence-based guidelines, but protocols that are built through the lens of one kind of person. And the people who don't fit in that category, oftentimes we're offering advice and guidance to them that has no relevance at all. And I don't think I need to really go on and on about this. I think you probably get it. But I mean, if you're telling somebody who has no money to go do something that requires money, yet they don't have the resources to do it, but that you're just following your protocol and feeling great about yourself, that's a waste of everybody's time and an irritation to the patient. And it's not effective and the patient's not getting better. I haven't found one yet, but I'm open to the fact that you all may come up with one that social determinants of health has nothing to do with your area of interest. Couldn't possibly be there. No, we lost Olu, she's coming back. However, if you're right, and it has absolutely nothing to do, like Olu's interested in AI, is there any bet on social determinants of health with AI? I don't know, never thought about it. If she comes up and says, no, there's none, zip, I can't think of any way to focus my lit review, then just do a general lit review. Just do one general on social determinants of health. Just follow the rubric and come up with, I'll forget because I don't have it right in front of me. It says so right here in the syllabus, how many articles you should have. It's not a systematic review of the literature. You don't have to do a Prisma diagram or any of that. It's just a narrative literature review. Just pick some articles, talk about the threads of what you found in them, and that's it. And then toward the end, you will do an interprofessional collaboration case study. A presentation of an interprofessional collaboration case study. We give you the case study, or you can go find your own. I have some built into the course. You can pick one of those, or you can go on your own. Now, usually I only have about 3 or 4 people in the course. I had quite a few this time. We don't want to hear everybody doing the same case, right? So we'll have to talk about that. That comes on like week 10 or something. We'll have to talk about that to make sure we just don't hear the same case over and over and over again. We want to, although it'll be interesting to get different people's take on the same case, but you know, we'll have to parse it out. The other, oftentimes students don't take the ones I put in the course, they just go look for one. And it's just anything, if you go into a search engine, you know, like Medline or Cinol or something, and type in the words interprofessional, you know, mesh terms for interprofessional collaboration case studies, you're going to get lots. There's lots of stuff out there. So you pick one and you do a presentation on it. Then you'll write your practicum summary and evaluation, and you will have done discussion boards. There are no tests in this course. Okay, going week by week. I'm not going to go through each week with you, but this is what Lauren was bringing up, is that if you went through this a few hours ago before I fixed it, there are weeks we have discussion boards where it said no discussion board. Now week 3, we don't have one because we added discussion boards to cover things that weren't getting covered elsewhere. And then anyway, never mind, but it's lined up now. So everything fits. Discussion boards, there's guidance on how to write them.
Dr.
Oh, here's wrong. I missed it. Lauren, look, here they are, the same old things right there. No, that's not right. I'll fix it again tonight and put up a new version.
Oh,
but
just the last screen you were in before you started scrolling in the syllabus, like keep going up where it had said, keep going. It was like back before you started scrolling down through the weeks.
Yeah.
I just wanted to clarify, there are only 7 discussion boards because this one lists 8 because it says week 1, 2, 5. 7, 8, 10, 11, but in the actual Blackboard, it's week 1, week 2, week 7, 8, 10, 11, 12.
There's no 5. 5's wrong.
Okay.
Five's a remnant. I'll fix it. Yeah, no 5.
Okay.
It's 1, 2, 7, 8, 10, 11, and 12. Correct.
Just wanted to make sure. Thank you.
That's all right. Sorry for all the confusion. All right. Here's instructions for the determinants of health. Read over this stuff. If you have questions, you can always just reach out to me, or you can wait till our next clinical conference to ask for clarification. But this comes up due early in the course, like June 8th, or it's about a week after our next clinical conference. There's the rubric. This is just the case study presentation. There's a rubric. Practicum summary, there's a rubric. More boilerplate. And I think that wraps it up. Okay, so that's that. Now I want to show you what the course looks like, because there are a few things in there I don't want you searching around. Let me share this. Okay. I do take attendance, but it just so I can keep track of things. It doesn't really affect your grade. I suppose I shouldn't have said that, but it doesn't. Here's the course. Now, one of the things I wanted to tell you right off the bat is, and I got to move all your little pictures around because it's right where I want to go. Are you seeing me moving stuff around on the screen? Yes, no? You looking at Blackboard? That's a yes. Okay.
Yes.
So I didn't follow my usual process today because we were in a colloquy all day long, and I raced home and didn't do it. Usually I'll send out an announcement in an email with the link to the session. I don't do it till the day because they change. They can change, or things come up and whatever. Although you're going to see in a minute, I have them in there, but I don't broadcast them till I'm sure that's the link we're going to end up using. Look over here on the right-hand side. There's course faculty, details and actions, so on and so forth. Mark attendance. And then here, books and tools. When you click on that, it takes you to all of these tools or applications embedded in Blackboard. and you just scroll down here to Zooms, and this is true of every Blackboard course. So you can use this on all your courses. If you can't figure out what the Zoom link is, you just come over here and you'll launch it. And there they are. See? So here we are today. We got a green dot because we're running. Here are the next ones coming up on May 28th. You can see it's already there because when I set up a course, I just set up the Zooms. But sometimes the Zoom links stop working. I get emails from the, different people, either IT at Madonna or Zoom, saying that, you have to change your link. And that's why I don't broadcast them until right to the end. But there you go. If you're ever in a course and you can't find the Zoom link, they're always going to be in that place in every course. All right, you've seen the syllabus. I think you guys know most of this stuff is the same in every course. Now you're going to see things tonight because I'm not in the student preview site. So some of this stuff is hidden from you. I can switch it over real quick to the student preview. Then you're looking at exactly what you get to see, not all the stuff behind it. I'm not going to waste time there. So the syllabus, course objectives, yeah. Why this doesn't want to go down, I don't know. Here's really what I want to show you. Look at course modules. I don't know why it's not opening. I'm gonna have to come out of this view. Wait a minute. I might have to show it to you in my view. For some reason, it won't let me scroll. The one thing you want to know in any course I teach, because I'm following a standard we set a long time ago, but I don't think all faculty at College of Nursing do, is Module 0. There's a whole lot of stuff you need in Module 0. Project concert instructions, the DNP preceptor agreement, although you can download that from the portal, from Find My Forms, it's there as well. Here's the DNP Essential Self-Assessment. And it's got a couple little documents in here. This is the tool. It looks like this, very small, but you can download it. So we take the most current essentials, which are labeled 2021, but they weren't actually disseminated till 2023. And here are the essentials. If you've never seen them before, there they are, 10 of them. And then some instructions. And then this is a Likert scale. I say follow Patricia Benner's model of novice to expert. If you don't relate to that, then I think nobody can get to be a nurse without having seen something of Benner's work. But anyway, 1 is low and 5 is high, okay? And you just go through here, and this is your document. It's in a downloadable Microsoft Word format on purpose. We want you to keep this for the rest of your time so that you can kind of mark off how you're doing in meeting essentials. So, if you mark it low on translating evidence from nursing science as well as other sciences into practice, if you came up with a 2 today, we expect by the time you get out of here, you're going to be a 4 or a 5. Does that make sense? How you choose to do it, you never turn it in again. Nobody's ever going to ask you for this again, except me this first time. But I'm telling you, where you will have to talk about how well you have used the essentials in your DNP work is when you present your DNP project, you're going to have to be able to talk about what parts of your project demonstrate the essentials. They don't have to do all 10, but they won't go away. My message is they don't go away. You might as well just kind of pay a little attention to it now, do your gap assessment, turn that into meat, but you keep it and use it. Now, to make that work even a little clearer, I gave you a link. And I don't know if I'm going to be able to open it. I'm not going to try to open it here. I think it's too many layers of stuff. But this is the same one. This is Panopto And this is actually on my personal YouTube. I have a lockdown account for Madonna stuff before we had Panopto. But it's me doing about 15 minutes of exactly how you fill it out. And the basis of all of this is this essentials document. Here they are. As you can see, it's a lot of pages. So I know you are going to study this. If you haven't been hearing about us having our upcoming accreditation visit, maybe you've heard about it, maybe you haven't. We do. We have our 10-year accreditation visit coming up this fall. All of the faculty are about ready to, have a nervous breakdown over it. But it's about this stuff. We get accredited based on how well we do this stuff. And here's the big deal right here. 2 levels. Level 1 is for entry into practice, and level 2 is for advanced education. So we focus on this in our programs, in the graduate program. That's what we're talking about. So you will have a copy of the essentials, although you don't have to read it all, but if you wonder about anything, you can. And when you get further down, this table, domains, competencies, subcompetencies, and so forth, this table for the advanced education is in fact what I just showed you in the tool. I just cut it out, put it in the tool. Now you rate yourself 1 to 5. Are there any questions? If you have any as they come up, just holler.
When do you want us to do this by? This is by the next conference?
Yeah, there's a date in the course, but yeah, about then. I just don't want you to wait too long.
Okay.
I should probably just tell you generally, I'm not a real stickler on, if you miss a due date by a couple days, I'm not going to take points. I don't do that. Not in this kind of class. There are some where I'm much more rigid about it. I'm not here. I mean, you have some flexibility. I appreciate it if you tell me I need some more time. Just send me an email. I need some more time. Because then that changes my tracking mechanism here, so I don't come after you saying, where's your assignment? I know, saves us both some time. It's very unlikely I'm going to say, no, you got to get it in on the deadline, or I'm going to start taking 5 points off for every 5 minutes you're late. No. I could do that. I don't like that style. It's just not my style. I'm more interested in you trying to relax enough to learn something and hopefully enjoy the course. That's more my point. So that's that. What else is in project or module 0? Uploads, like determinants of health, your practicum goals, your practicum summary, and then the case study resources I talked about. Here they are. Oh no, that's the upload. Well, anyway, that's where you find them. I'm a little worried that nothing opened up. I'm gonna have to go back and look at this. There should have been some articles that popped in there. I gotta write myself a note on that. I'll reload those. Not everything comes over perfectly in a copy, and I just missed that. So you need the interprofessional case study articles. This one over here is just a random article. If you haven't run across it, it, I think, absolutely explains. This is like a classic, this article from Morrison Winnings. And it's the answer is 17 years. What is the question? And it's about the understanding of time lags in translational research. Just for giggles, read it. I don't have any assignment related to it. I'm not going to question you about it. But it was enlightening to me to finally get what the heck is a DNP? After I was in the curriculum, I understood what PhDs do. I was still a little fuzzy on what's a DNP? Well, when I got through reading this, I knew we are here to close the gap of 17 years. That's what DNPs are supposed to do. And you can do that in a lot of different ways. You can do that through public policy. You can do that through a lot, you don't have to do that through direct patient care by a long shot. You can do it through leadership. But what we are here to do is to close the gap. It's a very interesting little article. I think you'll enjoy it. If you've never looked at the Boyer model of scholarship, I think you have to in order to fill out project concert stuff, but this is it. If you've never actually seen it, Boyer just had an idea back in the 1985, I think is when he first published about different types of scholarship. Not everything is discovery. This is what PhDs do. They discover new knowledge. This is kind of what we do, and they teach, they do other things, but that's kind of the essence of it. We are much more about application and integration, taking different things and putting them together into guidelines and applying the knowledge so that there isn't the 17-year gap of when it comes out of basic research and it's actually applied into practice. Okay. And then after that, you just get all the modules. I don't have them all open, by the way. I'm still, as you can tell, I'm still fixing things because we found problems tonight. But I'm as far as 9. So when you go into your student view, you won't see anything past 8. And again, it doesn't want to let me scroll down there to show it. Oh, here we go. See, when you get there, you won't see anything after 8 because I haven't finished doing, I have to update modules every time I teach the course. And I'm teaching a lot of courses right now. So I'll get that done in the next couple of weeks. The other thing, and I can't remember because I've given this spiel already so many times, I put an announcement out. I am a 12-month faculty. There aren't many of us, but so, and it isn't like it isn't a great honor. I mean, I just am a 12-month faculty, which means I actually have to take vacation when we are in a semester from time to time because the people in payroll get very irritated that my vacation bank is getting too large. They worry about the financial liability of that. I get that from being an administrator. I understand why the pressure. So I am going to be gone starting this Saturday, and I will not be back until the 28th. If you need anything that can wait, just wait till I get back. I'm actually only missing 5 teaching days, but I'm gone 10 days. Thing is, generally in this environment of graduate school, I'm working every day, I'm communicating with people every day. So I'll have a dead zone, but here's the deal. I'm going international. And what I learned by going international before is that our network at Madonna has such tight security, so many firewalls that you cannot, no matter what you do, connect to our email or Blackboard from outside the continental US. I don't know those of you who are international, if you've gone home and had that experience. I had the experience for the first time because over the Christmas holiday, I went with my family to St. Thomas, still in the US, not continental US, couldn't get on anything. Came back, said, something's wrong with my VPN, look at my computer, figure out what it is. And they said, no, we changed the filters, you can't, you'll never be able to. So, the good and bad thing is, it's frustrating to not be able to do it, but I'm going to have to really vacation. I can't even float, even if I wanted to. However, if you need something urgently, get a hold of Dr. Roxanne Roth. There's an announcement in there. If you don't know her, she's a very knowledgeable and very helpful and pleasant woman. She's our graduate chairperson now. She replaced Dr. Chan. She doesn't teach a lot in the graduate program. She has been the program director for our ABSN program. So that's who you get a hold of, Roxanne. She's my boss. All righty, I got something in the chat. Who can see your messages recording on? What's that mean? Oh, probably a good thing. So you can actually be on vacation. Yeah, Carrie, thank you. I appreciate it. Said as a true manager, you get it. Yeah. Yeah. All right. Let me look at my list. Let's go back and take a peek and see how we did at okay, we went through the syllabus. We talked about the D&P Essentials Competency Self-Assessment. We talked a bit with a number of people in the group about your D&P project of interest. I hope we'll hear more about that through the course. Talked about the practicum. Talked a bit about module 0, the important thing that people often can't find their uploads and things. In my courses, they'll always be in project 0. It's supposed to be a standard, but I know a lot of people don't do it. And that's it. What more can I do for you tonight?
I agree with
Well, then-
Carrie. I think it's good that you have to disconnect when you're on vacation because most of us continue to work. So
Yeah.
I'm excited for you to get away. That's exciting.
Right. And if you want to try texting me or calling me on my phone, I don't care. Just remember, I'm going to be in Italy and, the time change. Yeah. I'll be groggy if you wake me up at 3 a.m. I guarantee you. Like, who is it? All right. Well, great. I'll see you guys when I get back.
Oh, Dr. Lauterbach, just a second.
Sure.
Sorry, can you just expand? You had talked about the practicum is indirect clinical
Indirect, yeah.
hours. And
Yeah.
you said it's
Supervised
not,
indirect. Yeah.
it's not 120 face-to-face. Can you just clarify? So say that
There's a rule, there's kind of how that usually sorts out. It isn't hard and fast. We can assign some hours to different things you might do, like other lit searches, preparations, communication, all related to your practicum, things you do to prepare for the practicum.
Okay.
Emails you may write, all kinds of different kind of administrative stuff to support your practicum. And I was just talking to Dr. Roth today because we're always trying to make sure we're being consistent across the college and how we're doing this. I think I can just drop in, and I don't know how many hours yet. I'll let you know, next time we meet for doing that lit review. I think I can count that for your hours. I just have to come up with how many hours we can give for that. I'm thinking 20. You get 20 hours for that, something like that. Assignments usually run like that. But it's pretty broad what we can use. We just have to have something. Oh, I didn't show you Project Concert. Just before I let you go, let me do that. Hold on.
Okay. Yeah, because I want to try and figure out scheduling going with
I
a
get
potential person. So I just want to make sure that I hit where I'm supposed to. And I know you said if we're dual and we're probably over the hours, but I still want to make sure.
Yeah, I got it. That's fine.
Okay.
Project Concert. Good. Share this. Now I'll get back to Project Concert. All right. I'm gonna go in as a test student. And I'm going to show you 8710. And so practicum hours and indirect hours. You can use either. I can figure it out. But let's just say when you're really wherever you are doing whatever it is, kind of the face-to-face stuff. And although it says 120 required, not including this, don't worry, that's just the way the people down at Project Concert put it in. What I told you is the way we're going to do it. You would just put in a new entry and see, this is what you're going to get. Who is it? Who's the faculty? Me. Your elapsed hours. So let's say, Lauren, you're over talking and working with something with a CNO over at the hospital in Canada, and you were over there for 6 hours. 6. You can do an entry like every day, or you could wait till you have like 8 to 10 hours. But where you're going to put in your thing, put in your preceptor's name, the location, where it was it on site, was it virtual, was it Zoom visits, that kind of stuff. Some people have done almost all of their stuff by Zoom. Specify other, but here's the deal. You just write in, followed CNO to practice, nurse practice meeting and budget meeting. What I thought they'd put in here, but I now I see they didn't, is there's usually a grid of all of the essentials, and then you just click on which essentials it is, but I'm not going to change it now. We're just going to go with this. It's okay. I'm not going to bother showing you in another course what that looks like. Okay. And then you can check, you're never going to check direct care of patients in this practicum, really. That's not what you're supposed to be doing.
Okay.
Non-direct care of patients, not really. Simulation, sometimes people just have a real hard time coming even close to the hours. And we have a way to create simulations and give you your hours that you need, but based on simulation. So really, I'm going to actually have them change this a little bit, but don't worry about it. It'll look basically the same. You're going to be non-direct care patients most of the time. And if I give you a simulation to help you close the gap of like 20 hours or something, you'll check on that and you'll write in here you did the simulation. There's simulation assignments that I've developed. They're all custom, so I'll have to develop a new one for anybody who needs it. But I've only had to do it a couple times. People just couldn't get enough hours. And there's a way we can help you close the gap.
Okay.
Then you submit it.
Okay.
Yeah.
And may I ask one more question too? There was something just in this class, there's Project Concert, but in some of the other classes, and sorry to tailspin it for my own purposes here, everybody, but there's something about logging hours in Project Concert for some of these other
What
DP
course?
courses.
What
like
course
that
is
wasn't, I think it was 7,200, 7,310, 8,200, 8,350.
Those are the project courses. I don't have them in here, so I actually don't know what Dr. Burgermeister's put in.
No, okay, all right. I was just curious.
I can't get to her course. I can only get to these because I've asked them to create this for me.
Okay.
I think you're going to see something really similar to what you just saw, because that's a template that Project Concert uses for administrative things, but they can be more complex.
Okay, because I think it was something newer, because when I completed the 72 and 7310, it wasn't a thing. And now in 82, it's like there's a form that has all 4 of those courses. So if anybody else had seen or is doing those courses, if they
I'm surprised to hear you saying this, Lauren, because I think those project courses have hours associated with them, but they're all related to assignments.
Right, that's what I thought.
We don't need you to log any hours, I don't think, but it's not my course and I don't want to put my foot in it.
Okay, is anybody else, any of the students on this call doing those courses and know anything more about that? If I could ask.
What is the name of the course?
Oh, it's NUR 7200, 7310, 8200, and 8350. Those 4
They're
courses.
the 4 project courses that you do.
Yeah, so I don't know if anybody else has done those. I've already done 2 of them. So when I did them, Project Concert was never anything mentioned. It was, we got our hours from the assignments. But now that I'm doing 82 and 83, it popped up somewhere in the I can't remember if it was in the syllabus or somewhere in the course content, that it was saying something about Project Concert. Here's a form, you submit this form to Project Concert. So if anybody had heard about it, I was just curious. So I will talk to Dr. Burgermeister about it though.
Are 72 and 73, are those both 8-week courses as well, like 82 and 83?
Yeah, like they're all the steps of implementing the DNP, the project. Yeah.
Project.
Right.
Yep.
Yeah. First one is theoretical foundations for your project. Second one is writing your proposal on IRB. Next one is implementation, and the last one is dissemination. Okay, guys, you have a good evening. Anything else, just reach out to me. I'm always, other than the 10 days I'm not in the country, I'm always available. I don't mind weekends, whatever. Just go ahead and reach out. We got some more chats.
Thank you so much. Safe travels.
Sure, thank you.
Thank you.
Okay, good night.
Thank you.
Good night.
Good night.
Thank you, Dr. Larbeck. Good night, everyone.